All right, so thank you for tuning in. My name is Katherine Cox, and I'm a horticulture therapy student at Portland Community College. I'm taking the GRN 269 Therapeutic Horticulture Skills 1 class. I'm going to be doing a session plan with an acting patient going by the name of Iris, who is a stroke survivor. She had a stroke in her the left hemisphere in her brain, which is going to be affecting her right side. So she has weakness in her right side. This session for her goals physically, we're going to be working on strengthening the right side of her body. And cognitively, we're going to be helping to do activities that improve her memory retention, help her stay focused and concentrate, follow directions, and being able to recall the time and date. Socially, I'm going to be looking for her being able to communicate her needs or requests to me and being able to socially engage with me. Stroke survivors have a tendency to struggle with speech and understanding speech when they're in recovery. Psychologically, I'm going to be trying to support her ability to control her emotional outbursts, improve positive mood, engage in a leisurely activity, and promote her quality of life. This is just a project for school. I am not a licensed or registered horticulture therapist. This is just a project for school. And and I'll talk about my process at the end and kind of talk about how I thought it went. And we're going to be doing nature prints today. The session is called Iris's Nature Prints. And as I mentioned, our patient is just acting. She is not really a stroke survivor, but we are grateful for her being here today. So, Iris, thank you so much for joining us today. I'm so glad to have you here. How are you feeling today? What's going on for you? No. On a scale of 1 to 10, 10 being great and 1 being not well, how would you rate your feelings today? No?
No.
No? Okay. Is your arm hurting? Are you able to tell me on a scale of 1 to 10, 10 being really painful and 1 being fine, how painful is your arm? 7? Wow, okay. That's pretty bad. Would you like me to get you some water or an ice pack or anything? No? Okay. Well, I thought we would start today by doing our sensory activity. And if you want to pick up the rosemary with your left hand, that's on that side. Yeah, it looks like this. Yeah. And I thought we can start by smelling the rosemary. It smells so good. Are you able to smell that? What kind of memories is this bringing up for you? When you smell the rosemary, what kind of thoughts come to your mind?
Garden?
Garden? Oh, okay. Did you used to work in a garden? Or did you have a garden? Yeah?
Yeah.
Yeah. Did you like to work in your garden?
Yeah.
I really love rosemary. I love to use it in my cooking. Rosemary is a really great culinary herb. So, yeah. And they say that if you smell rosemary, that it can actually help your memory. Isn't that amazing? By the way, do you remember what the date is today? Do we know what date it is? What's today?
Saturday?
Not Saturday. Today is actually Monday. It's July 30th. Yeah, today is set Monday, July 30th. Okay, I might ask you that again. You think you can remember that? Yeah. All right. Let's go ahead and set that down. And then I want you to try using your right hand. And I want you to try and pick up the lavender. It looks like this. It's okay to use your left hand to support it. Good job. Good job. Very good. Very good. Here, I'll see if I can help you. So I want you to smell the lavender. Yeah. When you smell the lavender, what kinds of feelings are coming up for you?
Good.
Good feelings? What kind of memories come up for you when you smell the lavender? You don't know? That's okay. I have a lot of memories that come up for me. Whenever I smell the lavender, I actually, I think of these lavender cupcakes that I like to eat. There's a bakery right by my street, and they put lavender in the frosting on the cupcakes, and so it makes me want to eat a cupcake when I smell the lavender. That smells so good. A lot of people also like to put lavender spray on their sheets or on their pillow, and then it helps them sleep and it helps them relax. Yeah. So just a little fun fact for you. And if you want, you can use your left arm to put that back. Your left hand. Very good. Nice job. Okay. So that was, those are two of our plants. We have one more, and you can pick this up with your left hand if you want. It's a small green flower, or a small green leaf. Yeah, this is basil. We can smell the basil. Oh, that smells so good. This is also a culinary herb. Have you ever smelled basil before? No? Do you like Italian food? Yeah, a lot of basil is in Italian cuisine. Have you ever heard of pesto? Yeah, they put a lot of basil in pesto. Yeah, so that's really fun. So yeah, that's basil. You can go ahead and put that back. For today, what we're going to be doing is we're going to be painting some different, we're going to be doing some nature prints, and I'll do a little demonstration for you here. So for example, I love this one. It looks like a big heart. Isn't that so beautiful? So what we'll do is we'll take it, and I'm going to help you, of course. Get this little hat over here. Do you like this color? Yeah? So we'll just take a little bit of color, and I'll let you choose what colors you want. Just have that right here for us. And we'll take a brush. And I'm going to have you practice using both your left and right arm. And you'll just paint it. Okay? So that's one side. Do you want to try painting this side for me? I'll get a little more color on here for you. Here you go. I'll let you use this side. Yeah. There you go. And just paint that leaf. Good job. You're doing a very good job of concentrating and staying on task. Doing great. Very good, yeah. So I'm going to make it a little bit bigger so we get a nice big heart. And then we'll take it, and do you want to use your left hand, and you can help me press this down? Yeah, good job. We'll just press this down. Good job. The leaf feels so cool. Do you feel all the veins? Feels really rough. Yeah? How does it feel to you?
Pokey.
Pokey? Yeah, a little bit. Feels a little bit pokey. That's good. And then we'll lift it up. And then we have that heart. We have part of the leaf on there. Isn't that awesome? Yeah. So that's what we're going to be doing today. We're going to be doing nature prints, and we're going to be painting leaves and then putting them on this paper, and then you'll have this beautiful artwork to take home with you. Sound good? Okay, awesome. So the leaves are actually right next to you. You also have some on that side. I want you to try picking up a leaf with your right hand. No, it's hurting. Okay, go ahead and try with your left hand then. Are you doing okay? Would you like me to pick one out for you? You can tell me which one you want, or you can point, and I'll pick it up for you. No? Okay. So, you are doing such a good job with this activity, and I'd really love to see you finish. Would you like to pick a different color? Yeah? I'll put that in there. Okay. Alright. Let's see. Let's try this beautiful avocado leaf. Do you like avocados? No? Okay. Would you like to pick the color that you'd like to paint? Yeah? Oh, that's a beautiful color. That's a dark blue color. Would you like to give the color to me? Thank you. Okay. So I'll open that up for you. And then let's pick a new brush. Alright. How does this brush work for you? Do you like this brush? Alright. Here you go. And then you can go ahead and dip it in the color. Good job. Yeah. Beautiful blue. I love it. Good job. Okay. So we can flip it over. And then can you help me press down on it? Good job. You are doing a great job of staying on task. Yeah, nice job. Did you feel the leaf? It feels very different from the other one. It's much smoother. It's not so pokey. And then, oh, there's that one. That's so cool. What shape does that remind you of?
Boat.
Boat? Yeah, I could see that. It kind of reminds me of a boat too. Awesome. Oh, that's a good one. This is a great choice. Do you know what kind of plant this is? This is a sword fern. Sword fern. These actually grow in the Pacific Northwest. And sometimes at the very end, they'll kind of get like these curly ends. They're called fiddleheads, and you can eat them. We can't eat this one, but yeah, we're not going to eat this one. Here, I'll go ahead and put this in the water. What color would you like to paint the sword fern? I'll let you choose. Green? Oh, that's a beautiful choice. That's a nice emerald green. I love it. Let's try this one. It's a nice brush. Would you like to try using your right hand this time? No? Okay. I'll let you try dipping it in the color. Good. Nice job. That's a great technique. I love how you're adapting it to meet your needs. You're being very creative. Good job. Beautiful. Look at that bright green. Do you like green? Yeah, I do too. It's a great color. Good job. I'm so proud of you. That was huge. Great progress. All right, we're going to flip that over. I'm going to press that down. It feels so bumpy. Do you want to try feeling it with your left hand?
No.
No? Do you want to try feeling it with your right hand? No? That's okay. You don't have to. Oh, that's so cool. That's so neat. What a cool pattern. I love it. That's awesome. Would you like to pick another leaf? I have a few others out over there that you can try. Yeah, that's a good one. Awesome. What color would you like to use? There's so many colors. Would you like me to pick a color for you? Would you like me to choose a color? Yeah? Okay. How about, what's one we haven't used yet? Oh, this is a nice one. This is like an orange color. That might look really nice. Would you like that? Okay. Add that in there. I think I'll put this one. Are you done with the green? Yeah? Okay, I'll put that in there. Mix that up. Would you like to try using your right hand to paint this one? You did such a good job with the last one. Would you like to try again? No? Would you like to try with your left hand? Okay, awesome. There you go. There we go. Perfect. Nice job. Very good. Awesome. Do you need a napkin? No? Okay. I love that we're doing this together. This is so fun. Are you having a good time? Yeah? Do you want this to be our last leaf? Yeah? Okay. As soon as we're done with this leaf, then we'll stop. Alright. Do you want to help me press down this last leaf? Yeah. Oh, awesome. You're using your right hand. I'm going to let you do that one. Good job. Perfect. Nice. And voila. Very good. Right on. Nice job. Very good. So I'm really proud of how you were using your right arm and your right hand, and when you were adapting the activity to meet your needs. That was really creative. That was really smart. When you look at this picture, what kinds of feelings come up for you? Can I have your attention, please? You are doing such a great job of concentrating, and I want to see you finish the activity. What kinds of feelings come up for you when you look at this picture that you made?
I don't know.
That's okay. That's all right. Maybe we could start with the shape here. What feelings come up for you when you look at this shape, or even the color?
Red.
Red? Yeah. It's a really beautiful red. How does that red make you feel?
Heart.
Heart. Yeah. Yeah, it looks like a heart. It kind of does. It has like the veins. Yeah, that's awesome. And then why did you make the boat blue?
Blue boat.
Blue boat. How does the blue boat make you feel?
Water?
Water? Yeah, do you like the water? Yeah, I do too. I do too. Awesome. Well, you did a very good job. I thought we could talk about what was your favorite part of this activity? What did you like about it?
Blue boat.
You liked the blue boat the best? Yeah, awesome. Do you want to add any more blue to your picture?
Tired.
You're tired. Okay, that's good to know. Thank you for telling me how you're feeling. Okay. All right, well, we're going to stop the activity. And I'd also like for you to tell me one thing that was challenging for you. Arm, yeah. On a scale of 1 to 10, 10 being very painful and 1 not being painful, how would you rate your pain now?
6.
6? Oh, it's less. That's good. That's good. I'm glad that it's a little less painful. That's great. Good. Well, you made some great progress today, and I really enjoyed working with you, and I look forward to our next session. So thank you for coming and doing this project with me today. All right, so end of the session. Wow, Best Patient Academy Award for Iris. Oh my goodness. Yeah, I'm not gonna lie, that was really hard. when she was like not engaging and when she was getting really emotional, I was like, oh my god, what do I do? Iris did share that she had a family member that had a stroke, and I've never worked with someone that had a stroke. I've never known anyone that had a stroke, so you did a really good job.
Thank you. Yeah.
Everybody, all of my patients did a really good job, but I think that you take the cake, you take the Oscar home for the acting. So.
Thank you. Sorry to be challenged.
No,
so, yes.
That's good for me as a therapist. So yeah, as the therapist, like I think I could have responded to her emotions better. I think that I could have redirected her better or validated her. I should have validated her feelings rather than trying to be like, oh, let's do this. Like I'm a fixer. But it's also really important to validate the emotions and to acknowledge them rather than skirt them under the rug. So that's a tendency that I need to watch out for. So that's good. I thought that the activity was an appropriate level of challenge for the condition. It did require the patient to engage, and art does exercise both your left and right hemispheres. And I was also educating her, and I was talking to her about the different plants, the different qualities. I wasn't able to determine what she was able to discern from what I was telling her, and that's part of the condition of the stroke, is sometimes they don't understand language, or they're not picking up what you're saying, and so I would try and rephrase it. I thought I did do a good job of rephrasing it or asking a question in a different way. I think that this really pushed me to think on my feet a little bit more, and it challenged me. I thought that I had a good variety of different materials that she could choose from. I had a good selection, and the conditions were set up appropriately. You know, I mean, the plant material was within reach, and we had the water. We had all of our materials set out. She had lots of different choices, and I was really happy that at the end the patient reported that their pain was less. That was something that I learned from the ADA ROM-RU patient that I worked with. It's good to get like a scale at the beginning and at the end to see if the treatment is effective, and so that made me really happy. For the SOAP notes, I put that I haven't finished writing my notes, but I would say her chief complaint was that she was in a lot of pain. She rated herself at a 7. She also did say that she was tired towards the end. And that was a lot of activity for a stroke victim to go through. I was asking a lot of her. I was asking her to pay attention. I was asking her to follow directions. I was asking her to remember things. I was asking her to move her right arm even though she had weakness. And so, that's a lot. And she stayed engaged and she did a good job. I observed that she did have somewhat of an emotional issue, and she was kind of withdrawn. I observed the weakness in her right arm and hesitancy to participate, not being able to understand some of the things that I was saying, and so maybe I need to break it down better, or I need to use shorter sentences. I would say that she needs to do this at least 3 to 4 times per week. For just short sessions of 10 to 15 minutes. I would start out as the just individually with just me, one-on-one with the HTR, and then gradually maybe move up to a social setting. Once I thought that she was able to better control her emotions, because they say that working in group therapy sessions can actually help facilitate faster recovery, and so that could be potentially good for her. So that's what I would say about how that went. At this time, you can give feedback about what you thought or what I can improve on, and I'm curious to hear your thoughts, because Iris actually is a therapist in real life, so she has a lot of great experience and insight she can offer.
Well, thank you. Yeah, I think you did a great job of being receptive to me, and I did notice how you changed your language. I thought that was really good. And when I started to kind of zone out or disengage, you were quick to pull me back in, or to modify the activity by saying, can I pick a color for you, or can I help with that? And I think that helped, helping co-regulate someone's emotions. That was really great. I think that, you were really mindful of the length of activity, and I think that this, depending on every stroke victim, is going to be different and have different verbal, cognitive, and physical abilities, and so I think just, depending on the patient, maybe having some more support for their weakened arm, or some sort of table or desk, or
adapters,
however that looks. But I thought that this was a really great activity. And then also thinking about how, asking people to recall memories, that can be really difficult or incite a lot of emotions or whatnot. But I think you did a really great job of kind of scaling back and adjusting depending on my responses. So so I thought it was a really positive thing.
Yeah, this was really unpredictable.
Yeah, so, and it can be hard to know what's going on in the mind of someone who's had a stroke and where they're at, and just getting, because you don't always get a lot of feedback, and that can be a huge challenge, or you get a lot of feedback all at once, and, and so, that's been my experience with my family member who had a stroke, that it was just really a struggle, and feeling like we had to fill that space and that conversation because she wasn't necessarily giving a lot of information to us. So,
well, you were the right person to portray this patient, so great job.
Yes, well, thank you for letting me be a part of it.
Yeah, so thank you, and that's the end of our video. Bye-bye. This is the artwork when it was finished.